The silent early stage. This is another name for the organ called the pancreas. Pancreatic cancer is called this because it truly shows very few symptoms. And did you know that among all cancers, it has one of the lowest survival rates? That is precisely pancreatic cancer. Even for doctors on the front lines, early detection is extremely difficult. It is an illness that often leads to heartbreaking outcomes. Regarding such pancreatic cancer, today I will explain the symptoms it causes and what modern medicine has discovered. I will also thoroughly talk about the daily preventive measures you can take. To help you take action before anything happens, I really want you to remember today's information. Today as well, here at the Well-Aging Institute, let's continue learning important lessons for our health. Today's theme is pancreatic cancer. Pancreatic cancer has taken the lives of many well-known figures, including Apple co-founder Steve Jobs, iconic quiz show host Alex Trebek, and actor Patrick Swayze. So today, we're going to take a closer look at this disease and the important facts you need to know about it. Despite being strong and robust, even such prominent individuals fell victim to it. At the end of this video, I will also talk about the latest pancreatic cancer screening methods that have been gaining attention recently. I will explain them without any bias as a physician, so please watch until the end. Well then, let's get right into the explanation. First, hello, I'm Dr. Miso Lee, a Korean traditional medicine doctor at the Well-Aging Research Institute. First, since many of you may not be very familiar with the organ called the pancreas, I'll briefly explain what the pancreas is. To begin with, do you know where the pancreas is located? The pancreas actually sits behind the stomach. It has this cute tadpole-like shape. Most organs, such as the liver, are wrapped in a membrane called the peritoneum, but the pancreas is not wrapped by this membrane. It lies outside it, toward the back. Because it is located behind the peritoneum, it is called a retroperitoneal organ. This anatomical feature is related to the symptoms of pancreatic cancer that I'll explain later, so please keep it in mind. The pancreas has two main functions. The first is secreting enzymes that digest food: amylase, which breaks down carbohydrates, lipase, which breaks down neutral fats, and trypsin, which breaks down proteins. In this way, it plays an important role in producing the enzymes needed to digest food. The pancreas is connected to the duodenum, the part of the digestive tract located just below the stomach, and it sends pancreatic juice there to assist digestion from behind the scenes. Its second role is producing insulin, a hormone that is absolutely vital for human life. The job of insulin is to regulate blood sugar levels. Thanks to insulin, our bodies can control blood glucose, and when insulin becomes insufficient, various problems arise. For example, among diabetes types, type 1 diabetes is a condition in which the beta cells in the pancreas, which act like factories producing insulin, do not function properly, so blood sugar cannot be controlled and diabetes develops. Now, you can see the remarkable capabilities of the pancreas, an organ we rarely think about, and understand just how important it is. So when cancer develops in this pancreas, how are it examined and treated in real clinical practice? First, I'm often asked, can pancreatic cancer be detected with a blood test? The conclusion is that it cannot be diagnosed by blood tests alone. Of course, blood tests can measure proteins called tumor markers, which tend to increase in the presence of certain cancers. Pancreatic cancer also has such tumor markers, but sometimes the levels do not rise even when cancer is present, and at other times the levels are high even without cancer, so they can be used as a reference in health checkups, but not for a definitive diagnosis. Diagnosis of pancreatic cancer is mainly done through imaging tests. Tests such as abdominal ultrasound or CT scans using contrast agents can reveal tumors that have formed in the head of the tadpole-shaped pancreas, the pancreatic head. Inside the pancreas there is also a duct called the pancreatic duct, and when this duct is blocked by a tumor, it can become dilated, and that dilation can sometimes lead to the discovery of the cancer. As I mentioned earlier, the pancreas is connected to the duodenum, so using an upper endoscope, the camera can be advanced down into the duodenum, and from there, a thin tube can be threaded into the pancreatic duct to collect cells, which are then examined to determine whether they are benign or malignant. If pancreatic cancer is found at an early stage, surgery is possible as a treatment. However, as mentioned earlier, the pancreas is connected to the duodenum and has a very complex anatomical structure, so it is often impossible to remove only the pancreas by itself. In many cases, parts of the surrounding duodenum and the lower portion of the stomach must also be removed. For example, the head part of the tadpole-shaped pancreas is called the pancreatic head, and the surgery used to treat cancer in this area is called a pancreaticoduodenectomy, commonly abbreviated as a PD operation. This PD surgery often takes a very long time and is physically very demanding both for the surgeon and for the patient. If there are metastases, treatment with radiation therapy or anti-cancer drugs, as with other cancers, will be carried out. Still, it is most important to detect the cancer as early as possible before it reaches that stage. Therefore, next I will explain the symptoms and preventive measures that you should know to help with early detection of pancreatic cancer. On this preventive medicine channel, from a physician's perspective, we provide health information based on scientific evidence, so subscribing to the channel will surely be helpful to you. Now, let's talk about the symptoms of pancreatic cancer. First, pancreatic cancer can cause pain. This pain may appear in the abdomen or sometimes as back pain. As I explained earlier, the pancreas is a retroperitoneal organ located behind the stomach. A common feature of signals from retroperitoneal organs is that they may cause unusual pain in the back. However, abdominal or back pain can result from many different causes, so you cannot immediately conclude that it is pancreatic cancer. In this case, the pain is not so much due directly to the cancer itself, but rather because the tumor blocks the pancreatic duct inside the pancreas, causing pancreatic juice to accumulate and resulting in inflammation. This condition is called pancreatitis. Pancreatitis itself can also be caused by heavy drinking or very high triglyceride levels. For example, the kidneys are also retroperitoneal organs, and when there is inflammation or kidney stones, they too can cause back pain. Please keep this in mind. Now let's look at symptoms that are more characteristic of pancreatic cancer. The next symptom is jaundice. The word jaundice may sound complicated, but the meaning is simple. It refers to the skin turning yellow. When the skin becomes yellowish, there is a possibility of pancreatic cancer. This jaundice is caused by a fluid called bile. Bile is a fluid that helps absorb fat, and after being produced in the liver, it travels through a duct called the bile duct into the digestive tract. This bile duct actually passes through the pancreas, so when cancer develops in the pancreas, it can compress the bile duct, causing bile to flow backward. When bile flows backward, it circulates throughout the body, and its effect causes the skin and other tissues to turn yellow. In severe cases, it may also be accompanied by itching. This is because of a component in bile called bilirubin. However, in people who are heavily tanned or who naturally have slightly yellowish skin, it can be hard to judge based on skin color alone because of individual differences. In such cases, there are 3 points you should check. First, check your eyes. For most people, the whites of the eyes are normally white, so this is very easy to check. In many cases, jaundice appears in the eyes before the skin becomes yellow. To check, look in the mirror, pull down your lower eyelid, and if it looks yellow, it may be a sign of jaundice. There are 2 more things you should check together with this. They are your urine and stool. Normally, most bile is secreted into the duodenum, passes through the intestines, and is excreted from the body in the stool. But if that pathway is blocked by pancreatic cancer, the bile, having nowhere to go, circulates throughout the body and eventually reaches the kidneys. In other words, bile that should originally be excreted in the stool ends up being excreted in the urine. So what happens in this situation? First, the urine becomes mixed with bile components, and under the influence of bilirubin, its color becomes darker. Conversely, since the bile is missing from the stool, it is no longer a light brown color, but instead becomes a grayish color. In this way, abnormalities in the pancreas can indirectly show up as unusual signs in the urine and stool. Along with your eyes, please pay close attention to any color changes in your urine and stool. First of all, you will likely receive treatment to control blood sugar in internal medicine, but at that time, be sure to discuss this matter thoroughly with your doctor. As for the symptoms of pancreatic cancer like these, if you know of other symptoms or have personal experiences, please share them in the comments. It may be helpful for other viewers as well. Now, even though pancreatic cancer is such a frightening disease, is there any way to prevent it? First, speaking about cancer screening, at this point there is no pancreatic cancer screening method whose effectiveness has been clearly proven. The U.S. Preventive Services Task Force rates pancreatic cancer screening as grade D, meaning that in their view, the harms and complications of screening outweigh the benefits. Even if tests such as tumor marker measurement or ultrasound, which I mentioned earlier, are used as cancer screening for healthy people, the results have not shown clear benefits. That is what this evaluation means. Also, have you heard of a test called nematode cancer screening, which has been getting a lot of media attention recently? Some of you may have seen it reported in the media. This test uses a slender, worm-like creature about 1 millimeter long called a nematode, which can detect the smell of cancer contained in human urine, and applies that mechanism to cancer screening, an extremely innovative method. It has become a frequent hot topic. It is said that this could lead to early detection of various cancers, including pancreatic cancer, and is touted as a futuristic screening technique. However, even for this nematode cancer screening, there is still no clear data proving its effectiveness. Furthermore, the detailed follow-up tests after the initial screening may be expensive and not covered by insurance, and some point out that the harms from such detailed examinations might actually outweigh the benefits. There are also concerns about performing it on young people, whose baseline risk of cancer is very low. In short, many issues remain unresolved. To summarize, before proper scientific validation has been completed, it has already reached a stage where almost anyone can undergo the test. That said, I am not denying the future potential of nematode-based technology itself. I look forward to seeing proper research progress in the future. This is the part many of you have been waiting for. So, how can we prevent pancreatic cancer? I will explain scientifically proven prevention methods and lifestyle habits in detail. An interesting fact is that about 30 to 40% of pancreatic cancer cases can be prevented through lifestyle improvement. According to the National Cancer Institute in the US, proper diet and exercise alone can provide significant protection. Especially for those over 50, there are strategies you can begin applying right now. The information I share today will not only help prevent pancreatic cancer, but also diabetes, heart disease, colon cancer, and breast cancer. In other words, the habits you begin today can dramatically extend your healthy lifespan. Next is dietary fiber. Dietary fiber is not just for preventing constipation. It improves gut health and reduces inflammation, and this directly affects pancreatic health. Let's look at this more specifically. Choose whole grains, such as brown rice, oats, and whole wheat, instead of white rice or white bread. Whole grains are rich in insoluble fiber, which promotes bowel movement and increases beneficial gut bacteria. Healthy gut bacteria produce compounds that reduce inflammation. Legumes are also very important. Black beans, kidney beans, and lentils contain not only fiber, but also protein and antioxidants. It is recommended to eat beans 3 to 4 times per week, about 150 grams per meal. Fruits are also important, especially when eaten with their skin. Pears, apples, and kiwis contain most of their fiber in the skin. For vegetables, broccoli, cauliflower, carrots, and sweet potatoes are recommended, especially sweet potatoes. They are a low glycemic food and rich in fiber, making them an excellent choice. It is recommended to consume 25 to 30 grams of fiber per day. This equals roughly 1 serving of whole grains, 2 servings of fruit, and 3 servings of vegetables. When increasing fiber intake, increase it gradually. Increasing it too quickly may cause bloating or gas. You don't need to avoid all fats. What matters is the type of fat you choose. Unsaturated fats found in olive oil, avocados, and nuts actually reduce inflammation and protect pancreatic health. Olive oil contains a compound called oleocanthal, which suppresses inflammatory cytokines. It is recommended to consume 1 to 2 tablespoons of olive oil daily, preferably on salads. Nuts make an excellent snack. Eat a handful, about 30 grams, of almonds, walnuts, pine nuts, or cashews daily. However, avoid salted nuts and choose unsalted varieties. Avocados are rich in potassium, vitamin E, and antioxidants. It is recommended to consume them 2 to 3 times per week. On the other hand, certain fats should be avoided. Stay away from animal-saturated fats like butter and lard and oils containing trans fats. The reason to reduce saturated fat intake is because it increases insulin resistance and promotes inflammation. Fried foods require special attention. Oils heated at high temperatures during frying form trans fats, which are highly inflammatory. Avoid fried foods whenever possible, and if you must eat them, keep intake infrequent. Fish are also an excellent source of protein and omega-3 fatty acids. It is recommended to eat fatty fish such as salmon, mackerel, or sardines 2 to 3 times per week. Recent epidemiological studies report that adequate calcium and vitamin D intake may reduce the risk of pancreatic cancer. Vitamin D especially acts as a hormone that strengthens the immune system and regulates cell differentiation. Moderate consumption of dairy products such as yogurt, low-fat milk, and cheese is beneficial. The recommended intake is 1,000 to 1,200 milligrams of calcium per day. A single cup of low-fat milk contains around 300 milligrams of calcium, meaning you need 3 to 4 cups per day. If you don't like dairy products, plant-based alternatives such as soy milk or almond milk are also good choices. However, be sure to choose products that are calcium fortified. So how can we get vitamin D? It exists in foods like eggs, salmon, and milk, but the best source is sunlight. Exposure to sunlight for about 10 to 30 minutes per day helps the body produce vitamin D naturally through the skin. Late afternoon sunlight is considered most effective. Other dairy derivatives, such as buttermilk and cheese, are also helpful. However, choose low-fat or non-fat options rather than full-fat products. Now, let's talk about the foods you should avoid. Be cautious with heavily grilled or smoked meats. When meat is cooked at high temperatures, a carcinogen called heterocyclic amine is formed. This substance is especially concentrated in the charred portions. Processed meats, such as sausages, bacon, and ham, are no exception. This is why the World Health Organization classified processed meat as a Group 1 carcinogen. However, there are ways to reduce carcinogens while cooking. Marinating meat with tomato sauce or acidic marinades before grilling helps. Antioxidants help suppress the formation of carcinogens. It is also better to cook meat slowly at medium temperature rather than high heat. You should also avoid sugar and high-sugar foods. Excessive sugar intake leads to obesity and diabetes. People with diabetes have more than double the risk of developing pancreatic cancer. Sugary carbonated drinks are especially concerning. 1 can of soda such as cola or lemonade contains around 40 grams of sugar. This equals 80 to 100% of the daily recommended sugar intake. Avoid such drinks whenever possible, and if you must drink them, choose zero-calorie alternatives. High-fat and high-sugar foods like chocolate, cookies, and candy should also be limited. If you tend to eat them as afternoon snacks, replace them with healthier options like berries, nuts, or yogurt. Also be aware of foods made from refined white flour, such as white bread. These foods have a high glycemic index and rapidly raise blood sugar. Whole grain or rye bread is a better alternative. And finally, alcohol. Excessive alcohol intake directly damages the pancreas. Chronic pancreatitis is a major risk factor for pancreatic cancer. One of the most important lifestyle habits is maintaining a healthy weight. This alone provides a significant preventive benefit. Why is obesity dangerous? In obese individuals, fat cells release excessive inflammatory substances. Insulin resistance also increases, causing insulin levels to remain elevated. High insulin levels stimulate the growth of cancer cells. In fact, obese men have a 1.5 times higher risk of pancreatic cancer than normal weight men, and obese women have a 1.2 times higher risk. What is considered a healthy weight? It is determined using BMI, or body mass index. BMI is calculated by dividing weight in kilograms by height in meters squared. The normal BMI range is between 18.5 and 24.9. For example, someone who is 170 centimeters tall and weighs 75 kilograms has a BMI of about 25.9, which falls into the overweight category. In this case, about 7 kilograms of weight loss is needed to return to the normal range. The key is gradual and consistent weight loss, not rapid dieting. A reasonable rate is 2 to 3 kilograms per month. Rapid dieting leads to muscle loss and increases the risk of rebound weight gain. The method of weight loss is also important. Calorie restriction alone is not enough. It is effective when combined with the exercise recommendations that follow. Next is exercise. Exercise is not just for weight control. Exercise has effects powerful enough to compare with anti-cancer medication. Let's go over the recommended amount of exercise. At least 150 minutes per week of moderate aerobic exercise is recommended. Moderate intensity means you can talk, but not sing comfortably while exercising. Activities such as brisk walking, cycling, swimming, or jogging fall into this category. Divided throughout a week, that means about 20 to 30 minutes per day. In addition, do strength training at least twice per week. This is very important, so let me explain why strength training matters. Muscle is one of the body's primary consumers of glucose. The more muscle you have, the better your blood sugar control becomes. Therefore, strength training is highly effective for preventing diabetes. Strength training also has strong anti-inflammatory effects. So, what kinds of strength exercises should you do? Weight training in the gym is most effective, but push-ups, squats, and planks at home are also excellent options. You can also use resistance bands. Start with lightweight and gradually increase resistance over time. How exactly does exercise help prevent cancer? Exercise improves insulin resistance because active muscles absorb more glucose. Exercise also stimulates bowel movement and improves gut health. Finally, exercise reduces inflammatory cytokines such as TNF-alpha and IL-6. Muscle mass naturally declines rapidly after age 50. Therefore, resistance training becomes even more important. It is recommended to consult a doctor before starting a new exercise routine. Smoking increases the risk of pancreatic cancer by 2 to 3 times, a very significant increase. Carcinogenic substances in cigarettes spread throughout the body through the bloodstream. Smoking also causes chronic inflammation. Smokers have significantly higher levels of inflammatory markers than non-smokers. Notably, secondhand smoke is also dangerous. Exposure to secondhand smoke carries 40 to 60% of the risk of smoking directly. Therefore, if someone in your household smokes, encourage them to quit and avoid spending long periods in the same indoor space. The benefits of quitting smoking are remarkable. 5 years after quitting, cancer risk significantly decreases. After 10 years, the risk approaches that of a non-smoker. Therefore, quitting now is absolutely worth it. If quitting is difficult, use nicotine replacement products or consult a smoking cessation clinic. The same applies to alcohol. Excessive drinking causes pancreatitis. Chronic pancreatitis is a major risk factor for pancreatic cancer. Alcohol also creates oxidative stress when metabolized in the liver. What is the recommended drinking limit? The guideline is 1 to 2 drinks per day for men and 0 to 1 drink for women. One standard drink equals about 350 milliliters beer, 150 milliliters wine, or 45 milliliters distilled liquor. What requires special caution is binge drinking. Drinking large amounts of alcohol at once can cause acute damage to the pancreas. Alcohol interferes with calcium absorption and harms bone health. If you already avoid alcohol, continue to do so. If you drink moderately, maintain that level. If you drink daily, plan at least 5 alcohol-free days per week. Chronic stress and lack of sleep significantly weaken the immune system. Why does this matter? When you experience stress, the hormone cortisol is released. Short-term stress is not harmful, but chronic stress keeps cortisol levels elevated. High cortisol suppresses immune function. It especially reduces the activity of NK cells, natural killer cells. These cells play a critical role in eliminating cancer cells. Stress also alters the composition of gut microbiota. This increases intestinal permeability and promotes chronic inflammation. This is sometimes referred to as leaky gut syndrome. The same applies to lack of sleep. Getting 7 to 8 hours of proper sleep is not just for reducing fatigue. During sleep, NK cell activity increases and damaged cells are repaired. Harmful waste products in the brain are also cleared during sleep. Lack of sleep also increases diabetes risk. People with chronic sleep deprivation have poor blood sugar control and increased insulin resistance. So how can we manage stress? Meditation is highly effective. Just 10 to 20 minutes of mindfulness meditation a day lowers cortisol, and boosts immunity. Mobile apps can help beginners start meditation easily. Yoga is also beneficial. Yoga combines physical movement and mindfulness, helping both relaxation and physical strength. Deep breathing is also simple yet effective. Slowly inhale for 4 seconds, hold for 4 seconds, and exhale for 4 seconds. Repeat this for 5 to 10 minutes to calm the nervous system. Hobbies such as listening to music, drawing, or walking are also helpful. Most importantly, maintaining social connection is essential. Spending time with family and friends significantly reduces stress. So how can we improve sleep quality? Go to bed and wake up at the same time every day. This is the most important habit. Regulating your sleep cycle drastically improves sleep quality. Avoid bright screens at least 2 hours before bed. The blue light from smartphones, tablets, and computers suppresses melatonin production. Taking a warm bath or shower before bed is helpful. When body temperature drops slightly afterward, sleep hormones activate. Avoid heavy meals late at night. Eat lightly 2 to 3 hours before bedtime. Keeping your bedroom cool, around 15 to 19 degrees Celsius, 59 to 66 degrees Fahrenheit, improves sleep. If insomnia persists, consult a medical professional. Prevention is best, but regular medical checkups are also essential. Those with risk factors need to be especially careful. If you have a family history, chronic pancreatitis, diabetes, or if you smoke, regular screening is strongly recommended. The frequency of screening depends on individual risk level. In general, low-risk individuals should be screened once a year, while high-risk individuals should be screened every 6 months. Screening methods include ultrasound, CT scans, MRI, and blood tests. Checking the tumor marker, CA19-9, can be helpful. If any suspicious symptoms appear, seek medical evaluation immediately. Common warning signs include abdominal pain, jaundice, weight loss, and digestive problems. It may be difficult to put everything we discussed into practice immediately. Trying to change everything at once often leads to failure. Instead, approach it step by step. Step 1. First 2 weeks. Increase water intake. Drink about 8 glasses a day and reduce sugary drinks. Step 2. After 2 weeks, add 1 fruit and 1 vegetable to your meals. Example, berries in the morning, broccoli at lunch. Step 3. After 1 month, start exercising. Begin with a 10-minute walk each day. Step 4. After 2 months, improve your diet by switching white rice to brown rice and white bread to whole grain bread. Step 5. After 3 months, increase the duration and intensity of exercise. Making gradual changes like this allows new habits to form naturally and create a healthier lifestyle. The most important thing is consistency, not perfection. Follow the 80-20 rule. Make healthy choices 80% of the time and allow 20% for flexibility and enjoyment. This approach makes it sustainable long-term. In conclusion, the key to preventing pancreatic cancer is healthy eating, regular exercise, and avoiding smoking and excessive alcohol. Interestingly, these habits help prevent not only pancreatic cancer, but many other diseases as well. Heart disease, stroke, diabetes, colon cancer, and breast cancer share the same prevention principles. In other words, the habits you build now will determine your health 10 or 20 years from today. Your 50s are a critical turning point for long-term health. If you build healthy habits now, you can live actively and healthily into your 60s, 70s, and 80s. You don't need to be perfect. Just begin, starting today. Change 1 food choice, walk for 10 minutes a day. That alone is a meaningful start. And if you notice any concerning symptoms, seek medical attention promptly. Early detection makes a significant difference in outcomes. Now, let me summarize the conclusions about pancreatic cancer prevention. 1. Understand that at present there is no pancreatic cancer screening method whose effectiveness has been proven. 2. Do not be easily swayed by flashy new information. Muddu. Avktvoga undi pravotanu vilentka nivarinsandy. Such risk behaviors include smoking and heavy alcohol consumption. Studies show that people with diabetes have about twice the risk of pancreatic cancer, so controlling blood sugar is also important. If you notice anything suspicious, go to the hospital right away. Please be sure to remember these 3 key points. In addition, if you watch our video on common symptoms shared by many cancers, your overall understanding of cancer will deepen. Whether you give this video a thumbs up or a thumbs down, leaving a rating really helps us when making future content. I would greatly appreciate it. This has been Dr. Miso Lee from the Well Aging Research Institute. Thank you for watching. I'll see you again.